What if a degree that keeps our hospital running, delivers our babies, care for the sick, and respond to crisis suddenly lost its professional degree status? Well, in 2025, under the Donald J. Trump Big Beautiful Bill Act, that is exactly what happened to nursing in the United States. I know. Most of you right now wants to stone everybody that voted for Trump. But this is what Jesus said. Let the one that has never sinned cast the first stone. This is not the time to throw stones.
It is a time for shifts. It is a time for breakthroughs. It is a time for miracles. It is the time for showers. It is a time for shifts. It is the time for breaker. It is the time for breakthroughs. It is the time for showers.
Hello everyone, welcome back to the channel. If you're new today, my name is Andy. I am a family nurse practitioner. Today we are digging deep into a big policy change that happened in the United States that has affected the nursing and the healthcare system as a whole in US. The reason why I want to talk about this and why I think I am qualified to talk about this is because I have done it all. I started as a nursing assistant, became an LPN, went to get my RN degree, and now I am a nurse practitioner. And I have been a beneficial of student loans. And that is why I want to talk about this. What is it going to be for? What is it going to be like for future nurses, for students, future students, for people that want to get their advanced degree in nursing? What does the future look like? Today, we are all going to dig deep into it. Before we go there, I want to take you guys back a little bit to the history of nursing. Let's talk about how nursing evolved to the point of where we are currently today. And also, we will hit a little bit on COVID-19 and its impact on nursing and why all that is important and how it affects the future of nursing and also the healthcare system as a whole. COVID-19, nursing, healthcare system, educational system, board of nursing, board of education, they're all tied together, and this is going to bring a huge impact into the system as a whole. So let's talk about it. We are starting in the ancient civilization, okay, and that is the era between the 3000 to 500 BCE, and that is in ancient Egypt, where early forms of wound care and herbal medicine were practiced. India saw development of early hospitals staffed by attendants, while in Greece they contributed to Hippocratic ethics and observation techniques. And then the Romans established military hospitals known as Valentudinaria, hopefully I said that right, laying the groundwork for organized medical care. Now, moving on to 500 to 1500, that is the Middle Ages. During this time, nursing was primarily managed by monks and nuns, with monastic hospital expanding to meet healthcare needs. The knights provided care for the sick pilgrims, and during that time, something happened called the Black Death, which underscored the necessity for organized healthcare system. Moving on to the modern era, which is the 1500s to the 1800s, there was a reformation that led to the dissolution of many hospitals, shifting nursing responsibilities to untrained workers. However, the Sisters of Charity maintained a very structured care, and this era also saw the rise of military and municipal hospitals. Moving on to the birth of modern nursing, that is in the 1800s to the 1900s. That is when Florence Nightingale stepped in and revolutionized nursing during the Crimean War, with her emphasis on sanitation, statistics, and training. And then in 1860, the first modern nursing school was founded, elevating nursing to a respected profession. And this is also the era that the Red Cross and the national nursing organizations emerged, further professionalizing the field. 1900 to the 1950s, this is when World War One and World War Two happened. And during this time, advanced trauma care techniques and public health nursing grew significantly. And also that is when nurse anesthesia was developed. And university-based training for nursing was also recommended at this time, setting new educational standard for nursing. 1950s to the 2000. This is when specialization and education started being more formal. So the second half of the 20th century saw the expansion of Bachelor of Science in Nursing programs and the emergence of nurse practitioners in the 1960s. Advanced practice registered nurse roles, including NPs, CRNAs, CNAs, and the certified nurse midwife, the CNM, grew. The 1980s also brought the standardized NCLEX examination that we all take today, and the evidence-based practice became widespread, supported by expanding nursing research. Moving on to modern global nursing, which is 2000 to where we are today. The rise of Doctor of Nursing practice and doctoral programs, of course, is evident. Telehealth and digital health have revolutionized patient care, while nurses take on leadership roles in policy and public health. Now, the COVID 19 pandemic highlighted the critical role of nursing, and there is an increased push for specialization and autonomy within the profession. The journey of nursing from ancient times to the present day is a testament to its adaptability and resilience in the face of changing healthcare needs. As the profession continues to evolve, nurses remain at the forefront of innovation and compassionate care. Nursing is very important to the world that we live in, from the ancient times to the times that we are in. Let's look a little bit into COVID 19 and its impact in nursing as a whole in the healthcare system. I'm going to read a little bit of data, so I know. Stick with me, stick with me, stick with me. Let's get this so that we have a full understanding of what is happening and what is at stake here, okay? Let's get some water. Grab your water, okay? All right. This statistics is from the National Sample Survey of Registered Nursing, also known as the NSSRN. Okay, nearly 1.7 million nurses that reported experiencing some form of employment change during COVID 19. The most common change reported by RNs were temporarily floating, having to float from a different unit or department to a different one within the same employer. Nearly a quarter of nurses experienced some form of employment-driven employment disruption. This disruption included being forced to take a leave, being furloughed with or without pay, or being laid off, which I was a victim of that, right? I was furloughed without pay, and then I had to eventually find something else to do. Another job. Okay? A total of 510,000 RNs choose to leave their employer for another nursing job at some point between March 1, 2020 and December 31st, 2021. 195,292 nurses left the workforce altogether, either for a non-nursing job or to retire. The most common reasons for leaving the workforce were high-risk employment condition or high-risk working condition. That was 51.3%. Feelings of being overworked or burned out. That was 50.1%. Inadequate staffing. That was 39.3%. And unsatisfactory safety protocols. And that was 36.8%. About 84,600 RNs who left the nursing workforce during the pandemic indicated that they intended to return to nursing, while 19.5% indicated that they did not intend to return, and 37.2% were uncertain about whether they want to return to the workforce or not. In 2022 survey, RNs reported higher levels and more frequent feelings of burnout during the pandemic. The share of RNs who experienced feelings of burnout every day increased from 11.8% in 2019 to 25.7% in 2021. Now that we have gotten that out of the way, let's go back to the issue that we have at hand, which is the point of this video, okay? So if you live in US, then if you don't live in US, okay, this is a refresher. You can, do more research on this and, read up articles about this if you want to know more. So our current president, Donald J. Trump, brought out a bill called the Big Beautiful Act, okay? In this bill, one of the things that happened is that federal student loans were overhauled, okay? And professional students are now subject to new borrowing caps. And under this new definition, professional degree status, which qualifies people or qualifies students for higher federal loans, has been narrowed down to a small set of programs. Those programs that are now listed as professional degrees are medicine, pharmacy, dentistry, optometry, law, veterinary medicine, osteopathic medicine, podiatry, chiropractic, theology, clinical psychology. You notice in that physical therapies, nursing did not make the cut. Okay. As a result of that, future nursing students may only qualify for a lower loan limit, okay, and that is $20,500 to a maximum of $100,000 in lifetime. So what does this really mean for students who wants to go into nursing, especially those that want to do advanced nursing degree? This means increased financial burden. The program is already expensive. If there's no money to pay for it, to fund it, that means there's no hope, there's no way, especially people that are from lower income backgrounds, to get these degrees. And because of this, because it's so expensive already, because there won't be money enough for people to go to school, then there will be less and less and less advanced practice nurses, fewer nurse educators, and that matters a lot, both in clinical care and training of future nurses. Let's talk about the impact of this bill on our healthcare system as a whole. Because this change isn't just about the students, but it also affects the healthcare system in United States. Right now, we already know that there's shortage in nursing. Now, this is even going to make it even worse. Many rural and underserved areas that are already struggling to attract and keep qualified nurses are going to struggle even more. If fewer students pursue advanced nursing degrees, the shortage may even deepen, it may worsen. We were all witnesses to what happened during COVID-19, how lives were impacted, families were impacted, nurses were impacted, and yet every single day nurses were going out, putting on their uniforms, putting on their scrubs, and going in to work because there was no break for nurses. Government shut down, places were closed, there was a shutdown, and people were home. While others were home, nurses were still working. Nurses were still leaving their families, not knowing if they will get COVID-19 and give it to their families, which happened to a lot of families. Nurses were still getting up every day, not knowing what is going to happen to them. Most of them couldn't spend time with their families. Some had to travel out to help out to another state. That means days and weeks of leaving their families and children. And for the work, for the healthcare force, for people, we all know how that happens. So now imagine, in addition to that, now people can't even go to school anymore because there is no way of paying for it. So there's a huge shortage in nursing already, and now there's another level of you can't even pay for education, people that are willing to go to come help, people that are willing to join the profession to help, they can't even do that anymore because they can't afford to pay for it. Now let's think about how this will affect the future of the healthcare system and nursing in the years to come. Okay, don't think about right now. Think about the impact in a few years to come. People that are supporting this policy argue that it doesn't mean that the nursing is not considered a profession, or nursing has lost its respect. But like nursing organizations and students and people that are in the professionals like me, we say that this is a very dangerous move, okay, with real world consequences, because it's going to effectively punish the field that are majority female and essential to public health. We know that majority of people in nursing are females. I mean, we have a lot of men that are now open up to the profession, which is awesome, which is amazing. We love them. But this is really going to impact the future of that field. But here is what is clear. Okay? The policy doesn't magically make nurses or their work any less important, or the professional less important. If you care about the future of healthcare, especially in the underserved community, this is your time to speak out. This is your time to say something. This is your time to do something. Speak up, talk to your representative, support funding and fair loan access to nurses, because what happens next could actually determine who gets care, where, and when. You're in the healthcare industry like me, which I am a beneficiary of the student loans. I got loans. I paid my students. I tried as much as I could to pay for my school fees from my CRNA to LPN. I paid out of pocket. By the time I got into my RN, towards the end, at the beginning, even for my RN, when I was taking classes in community college, I was still paying out of pocket. But by the time I got into the tail end of the program and having to go to clinicals, I could not work as much as I would have loved to. So I did take loans, and then by the time I transitioned into my advanced nursing degree, I did take loans. So I am a great beneficiary of student loans. Now, when I finished my school, I did work for an FQHC for 4 years, which I got loan forgiveness. So thank God, me and the educational system of United States, the federal loan department, got nothing to do with each other. Thank God, by the grace of God, that was taken care of. Now, people have been asking me, Andy, do you want to do your DNP? Do you want to go back to, get maybe your psych, DNP in psych, or doctor of nursing practice? And I always said that I don't want to get any more loans. I'm right now, I feel good. Okay, I feel free. So I don't want to get myself into the bondage of student loans anymore. But that was just me knowing what I want and saying that I don't want to do that. But that at this point, even if I would change my mind, it means that that opportunity is no longer available. Essentially, that's what it means. That I don't, especially because when the lower your graduate or your bachelor's degree, you can get between 20,500 to 100,000 max. By the time you get to advanced nursing practice, those opportunities are no longer available. So for people that are thinking of getting their doctorate degrees, thinking of getting their maybe masters in public health, psych nurse practitioners, or family nurse practitioners, they have essentially, beginning from July 1st, 2026, will no longer have the opportunity to do so. And that, I feel like that is a very sad and difficult thing to do for nurses. I'm not exactly sure. I don't understand how nursing is not eligible for loans. I may be biased, but I think between medicine, doctors and nurses, they should be at the front row of getting loans because we need them and we cannot do without them. We need nurses. We need nurses. We need nurses. I don't know how else to say it. Like anybody now that is sick, or God forbid something happens to you, you go to a hospital. Nurses are going to be the ones to take care of you. Nurses are going to be the ones that know you better. Nurses are going to be the ones that discuss with you. Nurses are going to be the ones to hold your hands. Your doctor will come in there for 5 minutes, write a prescription, and move on to the next victim. Oh, my bad. Patient. But nurses are full of compassion. They have that compassionate care, empathy, warmth. And I'm not saying it's 100% all the nurses, but I'm saying that you will find a lot of nurses that are very warm, very nice, very comfy, very comforting, and that will take care of you. And during the COVID-19 pandemic, patients saw nurses more than their families. Their families were not even allowed to see them. The people that were interacting with them daily were nurses. So I would really, really say that the government should think about this again. Just go back to your homes and think about, put yourself, forget about the government, put yourself as a patient and think about your family, your wife, your daughter, your son. If something were to happen to them and they walk into a hospital, regardless of which hospital, think of the profession that actually do care for them. If you're a nurse, if you're a future nurse, a future student, share this video. Let me know what you think. Do you think that nurses should be cut out of the professional status list and lose their eligibility for loans? Do you think that is fair? Do you think that is unfair? Let me know. And if you want to see more content like this that talks about healthcare, daily lives of a healthcare practitioner, the policy changes in law, please subscribe, hit the subscription button, turn on the bell notification so that you're aware. The next thing we are going to talk about is the big pharma. Okay, all right. So look forward to that video. Until our next video, love you with the love of God. Bye.